Hello, I'm Robert, and this is to counteract this rather misleading idea that is getting around that Omicron, we can just let it spread and we don't need to worry. If everyone gets it, it'll be absolutely fine. That's what it's based on an urban legend that viruses evolve naturally to be mild. And that idea has been going around for quite a while. And even as the COVID got more and more serious, through ancestral to alpha to beta to delta, then we still got people saying, but eventually it'll get mild. So now we've got Omicron come along, and it's a lot milder. And so people are saying, that's the way it's going eventually. It's only one variant that is now milder, possibly. This does not mean it's going to go mild. Dr. Tedros warns that it can evolve in ways that we cannot predict nor prevent. I mean, it'd be wonderful if it was guaranteed to go mild, but it's not. And Dr. Mark Ryan said there's an assumption that as a disease becomes more transmissible, it will become milder. And that's a bit of an urban legend around that process. That doesn't necessarily happen. Whether it is more or less severe is much more random. And the reason is because the virus is long gone, especially with COVID, and it's your body fighting back that makes it serious and that eventually might kill you. The virus has gone long ago, weeks ago, when most people die. And so it's really quite random as to whether what it did in those early days affects your body and triggers your immune system in such a way that later on you die. Now, we can design a vaccine to stay mild, but Omicron was not designed. And it's got so many mutations, these open a door to a whole new landscape. And we don't know which way they'll go. They could go milder, they could go more serious, they could just stay the same. And so we should not rely on COVID to just go away and become milder. We will need vaccines, we need the masks, we need to do it all to end the hospitalization and the public health emergency. So we can do it. We can make it mild with well-designed vaccines and distributing the vaccines globally to everyone who needs them, doing it all as fast as possible, as much as possible to break transmission, making the new therapeutics, we've got marvellous new therapeutics, accessible to everyone and helping to counteract the infodemic. And in this way we can end the death and tragedy and the global health emergency. And that's what we need to do. We need to keep doing that. So there's an example here. This is my own example, not from anyone else. But Sabin's, I think, is a very good example of how we can't rely on it to stay mild. This is Sabin's live attenuated polio vaccine. He made it back in the 1950s, very early days. And he made it by a very simple process of passing it through lots of animals, mainly mice, and things like that, over and over again. And that caused polio to adapt to the mice. And then when he reinfected humans at the end of it, and he infected himself and his wife, I think, first, then they got just a mild disease. And so he had managed to attenuate polio to a mild disease, and then he was protected against polio. So the experts, but the problem with Sabin's live mild attenuated vaccine is that once in every 750,000 doses it reverts to severe. And so this then sparks off outbreaks of severe polio. And this is actually happening. It's still happening around the world. Sabin's vaccine was incredibly successful. It was useful for countries that couldn't afford the more expensive inactivated Salk's vaccine. But it had the downside that every now and again it would set off a new polio outbreak of the severe disease. And it's the main reason we haven't managed to eliminate polio yet, is because of this reverting of Sabin's vaccine. Now, Omicron has, we will, has its, I'll talk about that in a minute, it's quite likely that Omicron spent some time in animals, so it's a very close analogy to Sabin's live attenuated vaccine. And Sabin, in this article, I'm going to look at two landmark papers that came to opposite conclusions. One thought so far the evolution has been from ancestral to alpha to delta, direction has been towards more severe. And one of the papers says it'll go back to mild, the other says they could continue to go more severe. So I'm just going to say, I've done this article, it's got these links, and if you click on them, they'll take you to the next section, like that. You click on the next link, so it's a quick way, and I've written the titles of the sections, so if you just read the titles, you get a first impression of the article. So I've done this to counteract misinformation about, in the article saying we should just let it spread. And the vaccines are, the vaccines, they do continue to, the vaccines are likely to continue to protect against COVID, but the 50 plus mutations of Omicron, then they've basically opened a whole new landscape of possibilities to can evolve into. And but it is possible to design a mild variant of COVID. I'll come to that in the next section. And that's Sabin's vaccine, and the it's possible to design a safe, mild variant of a deadly vaccine, and measles vaccine is a good example of that. That it didn't revert like Sabin. It's much more. It's a very mature vaccine, and so the measles vaccine is actually a mild version of measles, but it doesn't give you any disease. And so all of us, who've had the MMR vaccine, we've actually been infected with a very mild variant of measles, designed to be symptomless. So it can be done in a very safe way, but you need to design it. And Omicron is not a measles, is not a vaccine. Yes. So this is about the early reports of mild cases. So you've probably all heard about that, and the idea is the blessing in disguise, and we don't know. And then we get to Dr. Tedros, who warns it can evolve in a way we can't predict. And here's Dr. Mike Ryan's quote that I talked about, that and he talks about how there's an evolutionary pressure for the virus to adapt and become more transmissible, but the severe outcomes come much later, as I explained. So you can go down there and it talks about that. It's the severe outcomes are mediated by our immune response, and our immune systems are response to the virus. And so we don't expect the viruses to become milder. It can happen randomly, but it's not the direction that they tend to go. I think we've given Sabin's facts. I think this needs a little bit of work because I've got a bit of repetition here still. Anyway, so out of the many possibilities for Omicron, one possibility is it was infected in rodents, and the reason is amongst the evidence for that is that some of the changes, I don't think I mentioned that there, but some of the changes that they see in COVID, in Omicron, are 7 of the mutations actually found in rodents. And so then COVID is related evolutionary to the viruses way back in 2020, quite early in 2020. And it's not, although it's got the same mutations as alpha, beta, gamma and delta, it's got all of them, it's not related to any of those in the evolutionary tree. Its closest evolutionary relatives are amongst the ancestral. So this is really quite surprising. It could have spent a year, but in a year is a very long time to spend in someone immunocompromised. And that would be quite surprising, because the more it spends in one single person, the less it adapts to jumping to other people. It just develops a nice cozy host in that person, and it doesn't tend to be very adaptive to spreading to others. And it could have evolved in a separate group of humans who got infected way back in 2020 and then had no contact with anyone else until sometime in 2021, late 2021, in October 2021. But there's so few humans populations that are that isolated. So a very few uncontacted tribes in a jungle, you can make up a possible scenario, but it's a very low probability scenario. And uncontacted tribes, you have very little contact with anyone else. But especially because it's got these mutations that are similar to the same mutations you get in mice when it adapts to mice. And it seems quite likely they jumped to a population of mice somewhere in the world, and they don't know where it came from. South Africa traced its outbreak back to Botswana, and then Botswana, which is next door country to South Africa, in the south of Africa, and then Botswana traces its outbreak back to 4 diplomats, and those 4 diplomats come from other countries, but because of all the travel bans and the stigmatization against South Africa and Botswana, then Botswana could have just deflected the blame and said, oh, it came from X country, and deflected the blame away to yet another country, and they didn't want to do that. So they are not revealing to the world where those diplomats came from. So they could have come from anywhere. They say they stopped over in Europe on the way, so they could have got it in Europe. But they could have got it in their country of origin, wherever it was. So we don't know where COVID comes from. I mean, there could have been African diplomats who went to Europe and then went to Botswana. They just don't say where they came from. They say they got to Botswana via Europe. There could have been any country in the world before then. So we don't know until later on, maybe be less politicized, then maybe we will learn from that where it originated. And so and yes, just to say that you can have a safe live attenuated polio vaccine. And this is an idea that I haven't heard anyone make, say, amongst the experts that I follow. But in the case of smallpox, then there was the variola major, and then there's variola minor. And variola major then won 30% fatality rate. Variola minor, also called alastrim, had only 1% fatality rate. So as well as the possibility it evolves to be milder, it evolves to be more severe, we also have the possibility that we have multiple variants simultaneously. And that is a very common situation. There are 3 varieties of polio 1, 2 and 3. There are 4 main varieties of flu, each of which is divided up into multiple variants, and which coexist. And then sometimes it's more of one and sometimes more of another. And HIV is divided into HIV-1 and HIV-2, and HIV-1 is divided into numerous subdivisions. And so we could easily have a situation so far, for some reason, it's been nearly all Delta except some Beta around, and then it looks like it's going to be nearly all, or maybe all Omicron. But we could have a situation where, for instance, we have a severe and a mild variant of Omicron coexisting. Or we could have Delta coexist with Omicron. Or we could have another thing we have, which you have with dengue fever, I think it is, you have alternating variants. So it could be that Omicron surges, then Delta surges, then Omicron surges, and Delta surges back and forth, on and on into the future. So there are many different possibilities as to how a virus can evolve into the future. So yes, I think with dengue fever you have a variant which is the one which gives you the first infection, and you have another variant that is your second infection for people who've already been infected. So that's another possibility that we could get, is have one variant that is very good at infecting people who haven't got it yet, another variant that infects the people who've already been infected. So there are loads of different scenarios that we get with different viruses that could happen with COVID. And then any of those variants could be either mild or severe in those scenarios. And then a new variant also, it could get milder for some conditions or age groups and yet be more severe for others. And we've had this with Delta, and we've had this again with Omicron, a concern, because it's a big mystery, why don't young kids get COVID severe? Because with flu, young kids get it severe. But with COVID, they don't. And there are theories about why it is, and maybe because they've got very few of the ACE2 receptor. So then, if a variant of COVID was to start using a different receptor, it might get more severe for kids. And so there's always this, or it's got some different way of infecting or something. So there are reports coming out from South Africa which may suggest that it's a little bit more severe for kids than Delta, but it's just so early, it's impossible to tell. It's far, far too soon to generalise from such few cases. So this was a talk there about how there's early speculation that the Omicron variant is sending more children to hospital than in previous waves, but that could just be because it was surging so fast. So it's really impossible to tell. But what everyone agrees is that you need to get vaccinated, and that's the safe way. That's the way the vaccines we have, although they seem to be very ineffective at stopping the symptomatic disease, they do seem to be very effective at with previous variants. They've been gradually eroding the effective, but even AstraZeneca is much less effective than Pfizer against symptomatic disease when you've got double dose vaccinated. But they both remain very high level of protection against severe disease. And for severe disease, you've got things like the T cells, which are much less mystified by a variant. They have a more holistic view on the antibodies stop the virus before it gets into the cell. The T cells look out for infected cells and they destroy these cells so they can't spread the virus to other cells. And the T cells have a much more holistic kind of view of the virus, and they're much less easily evaded. And the T cell response is likely to still be quite strong with the vaccines against Omicron. So the vaccines are expected to still have a significant, but they don't know how good an effect against severe disease and death and hospitalisation. So definitely do get vaccinated. And the booster, the preliminary results for Omicron is that the booster, I haven't got it in here yet, is that the booster is a fourfold reduction of the risk of even symptomatic disease for Omicron, 70% to 75%, up to fourfold. Now, I wanted to talk about although Omicron is not possible as a vaccine, it is possible, as I said, to have a mild variant as a vaccine, as we've got a very safe, mild measles vaccine. And it would be possible to have a safe, mild COVID vaccine, and not many people know, and I didn't. I was vaguely aware of it, and then I looked it up for this article, and this is by Codagenics. They've got a vaccine candidate they call Covivac, and this is already in phase 2 clinical trials. They did in phase 1 first, which they did in a special quarantine facility designed for COVID challenge trials, where even if it was as dangerous as COVID, it would still be safe because in this facility, but as they expected, it was very mild, just as it was with animals, and it was safe. So they then went on to phase 2 trials after having proved it's safe in that sense. It's not going to go around and infect everyone and start a new variant of COVID. Then they're testing it they've tested in phase 2 and no longer in quarantine, and then they're going to be testing in phase 3. And this variant of COVID, it's rather mysterious how it works. It's really quite intriguing. They designed 283 carefully designed mutations, and what they do is they look at the code, and each amino acid in a protein is coded for by codon of 3 letters in the gene sequence. So a protein is made up of amino acids, whole series of these little chemicals, and each one is coded for by 3 letters in the gene sequence. And the gene sequences, each protein has multiple ways of coding it with these three letters. So it's not just one letter. So what they do, and you think, well, this won't make any difference to anything. So the different choices of the code for the same protein. So the virus is the same virus, does the same things, but it's got a different genetic code. But what turns out, everything else is the same. The proteins, the enzymes, everything it produces is the same, but the code is different because there's multiple redundancy in the code. And what they found is that if you can manage to change these little triple codons in such a way as you increase the number of times that a G follows a C in the code, and the number of times that an A follows a U, then the virus replicates much more slowly at a snail's pace. It's the same virus, it does the same things, but it produces much less of every enzyme, it produces much less copies of itself, gets into a cell, and it just goes into slow motion. It just goes like that. It just goes into slow motion, just very, very slow, does everything very slowly. And this then makes it very easy for your immune system to fight it. So basically they've disabled the vaccine, but the rather interesting thing is nobody knows why this works. They noticed that they started off by first of all noticing that viruses, RNA viruses, so viruses that replicate. So the thing is that your cells in your body are not able to replicate RNA. Your body produces this, all the RNA in your body comes from the DNA in the cells. And the DNA in the cells then produces messenger RNA, which then goes out to your cell and it produces other kinds of RNA, and it just goes out to the cell and the RNA then makes the proteins. But RNA viruses, they basically construct a replication machine. They're incredibly ingenious and clever. They develop a lot of enzymes which then zip together the RNA and translate it and make it into a new RNA copy of the original RNA. So the COVID virus, when it infects your cell, it actually makes a replication machine inside your cell to make a copy of itself. And they found that there are lots of different RNA viruses, and they found all these RNA viruses, for some reason their codes were notable of having very, very few instances of G following a C or an A following a U. So then people thought, well, what if we just artificially increase those numbers? Why are these viruses avoiding these sequences? Why aren't they doing that? So they just increased those numbers, and they found that the virus, the results still replicates perfectly well, but just very, very slowly. And nobody knows why. At least, the papers I tried to find, I looked up papers, and they're just people saying, we don't know why. So, as far as I know, it's not been resolved yet. Nobody knows why the RNA viruses evolve these sequences, and why introducing these sequences make the RNA viruses so slow. But that's basically what they did. They said, oh look, the sequences are avoiding these sequences, so let's put them in, and it'll slow it down, and lo and behold, it does, and the result is a very mild version of COVID, and then with so many mutations, there's no realistic chance of it evolving back to be serious again. Now, this is never going to arise naturally, because the RNA viruses avoid these sequences, but we can construct it, and we can engineer a virus to be like this, and then that'll be a safe virus, so we can engineer a virus to be safe. But a wild evolved mild variant is never going to evolve Covimac. You could leave it evolving in humans for 1 million years, it's never going to evolve Covimac, because it avoids those sequences. So now I just want to go into why, a little bit more into this thing about, this is about what Dr. Mike Ryan was saying, about how most deaths happen way up there when there's almost no pressure on the virus to reduce death. Indeed, this paper, so the two papers on the topic, one says it'll get as mild as common cold, the other says the virulence theory basically doesn't work. The theory that's going to go mild is not convincing. And so they say that there's actually, it's good for as far as the virus is concerned. The more virus you can have early on, the better. And there's no trade-off because the deaths happen so much later. And for example, with HIV, then if you get lots of virus early on, then the HIV is you're going to get HIV much faster. And so it's actually a more dangerous version of HIV. So quite often, the HIV versions that are more transmissible are also often more dangerous. So it can actually even go the other way. So, and there's some sign that this is true for SARS-CoV-2. There's limited evidence that increased virulence is associated with various other life history traits that adapted to the virus. For instance, that you get higher viral loads and you infect more people if you've got increased virulence, and you tend to infect more. The people who have got higher viral loads tend to be it's more virulent in them, and they infect more people. And the people who develop more severe infections tend to have higher viral loads earlier on. So there is some possibility that these pressure to become more transmissible will actually make it more serious. So if Omicron has gone milder as a result of going through animals for a year, then it may start getting more serious again once it gets back to humans. Of course, one wishes that wasn't true, but that may be what happens. So we need to treat it very seriously and not just say, oh, everyone should get it. And then there's the evidence from the actual diseases itself. If you look at the 4 common colds we have, they are all mild. So that seems quite impressive, that SARS, MERS and COVID are all serious. And OC43, HKU1, the NL63 and 229E, they're all mild. So you think, sure, that means that it evolves very quickly, it evolves to be mild in humans. But it's not so convincing once you break it down into the details. First of all, HKU1, that crossed over in around 1950. And if they go and look at that's when it crossed over, HKU1. And then if they go and look down there, have I got it down here? See if I can find there we are. So if they then back project to what a disease like COVID would have been like in 1950, how serious it would have been if HKU1 has been as bad as COVID. And they reckon that our health systems way back in 1950 would easily have noticed it. It would have been a significant pandemic, and they don't find any such pandemic back then. So HKU1 was definitely milder than COVID when it jumped over in 1950. So that's one that's mild. And then we've got OC43, that's the mystery, that's all the things about. Then NL63 and 229E, they both go back to a common ancestor about 1100. If you look back, you can see that they evolved away from each other. And so whether that was originally serious or mild, it's neither here nor there, because it's had all those centuries to evolve to be mild, if it did evolve to be mild. So it's not really much comfort to say that, several centuries from now, COVID is likely to evolve to be mild, if that was originally serious. So that just leaves us with OC43. And that crossed around 1890, and there was a big pandemic around 1889. And the big argument is, was that OC43, or was OC43 always mild, like HKU1? And you look at the survivors of that pandemic, and the survivors all had antibodies to H2N2, influenza. And the H2N2 can show, so they had symptoms that are similar to what you might expect to an ancestor to OC43, but they are also symptoms that are similar to what an influenza pandemic is like when it first jumps to humans, where you tend to have more neural symptoms than you do later on with later waves. So flu, it definitely does get milder after it jumps to humans. But this is not, it has with several pandemics. But that doesn't mean that COVID will, because it's a very different kind of virus. It's not It's not an influenza virus at all. So, this is just not. It's not certain that OC43 was originally serious. If it was, then it got mild very quickly, and that would be kind of hopeful that maybe. But of course, just because one coronavirus doesn't mean that COVID will as well. So, so when you look at it like that, then the evidence isn't that strong at all. Another argument you get is that COVID could get milder by specialising in the upper respiratory tract. Now, the problem with that is that the D614G, that increased the load in the upper respiratory tract, as you'd expect, in order to infect others more, but it didn't reduce the loads in the lower respiratory tract. And it's one variant that actually preferentially infects the lower tract in France, or did when this paper was written, perhaps to evade nasal swabs. So so it's not necessarily the case that it's going to evolve to stop infecting the lower respiratory tract. There's not clear that there's any evolutionary pressure. There's evolutionary pressure to start infecting the upper respiratory tract more, so that it can spread to others more. But it's not so clear there's any evolutionary pressure to stop infecting the lower respiratory tract. And then, and there's another thing is the idea that if kids get it when they're young, then it'll be less. Then they will get it less severe as adults. Well, to start off, that's a long way to wait. That our kids, when they become adults, 10, 20 years from now, that COVID will be less severe for them as adults than it is for them than because they got it as a child. But it's not at all certain that this is true, because immunity from COVID is very short-lived, and when variants evolve to escape the immunity from the previous variant, this doesn't necessarily reduce the virulence. So it's not at all certain that this argument, which you hear quite a lot, this paper says it's not convincing. And so if COVID gradually over the next several years, evolves to get milder and milder, then you get the people who wrote it's going to get smiles at cold paper, they say, I told you so. But if it stays severe, then the other group who vote against their virulence here, they will say, oh, told you so as well. So we just don't know. We've got scientists saying different things, and that's normal, that's healthy, that's how it goes. We get our wisdom in science as a result of the dialogue of different points of view. And it's because we've got so many different scientists saying so many different things that we're able to get a full picture and understand. One person couldn't really develop science by themselves very easily, because they tend to get tunnel vision. You just can't avoid it in some area or there's something they like, something they follow through. And so we just have to say it's open for now. However, the vaccines definitely work. They reduce the deaths, and vaccines, the less transmission we have, the less variants we have, and vaccines work very differently from the way. And then we've got all these different layers we can now use. We've got so many tools we can use to stop the transmission. So we're not back to square one. We are square 2 or square 3 or square 10 or something. We're quite a long way ahead of this virus now because of all the vaccines and all the other measures we've got to stop it. And so even if Omicron starts turning serious enough, and now as well, we may well end up in lockdown again, but the more that you can do, it'll be a much more intelligent lockdown if we do end up in lockdown, because people have much better idea than they did earlier on as to how the virus spreads and what needs to be closed down and what doesn't. And the more we can do as individuals to stop it from spreading amongst ourselves, then the better it is. Wear masks, do it all. And I've already talked about this in my other video, so I'll just say, yes, your eyes can smile too, so it's not a question of smiling or masks. And let's just quickly go through that. Yeah, that's a bit out of date data now. I've already talked about this in my previous video, that if you get COVID, then do isolate away from your household. But I would like to talk a little bit about and that way there's only one chance in 5 that it spreads to the rest of your household. You can reduce that chance by isolating quickly if you get COVID. I'd like to talk a little bit about how most of the transmission is in households, and if we can stop transmission in households, we can really make a big dent on transmission, and really maybe that's the way we can find an edge against Omicron. And so this tonight I'll do a separate video about that, because habitual mask wearing, and yes, I don't want to go on and on about that, but this is a suggestion that if you wear masks habitually at home. Let me just, I wonder how long I've been talking for. I think I've got the main point of the first bit, which is that just be careful, look, and that dovetails to my previous video that I just did. Yes, I'll stop this now, and then I'll do a video about the masks thing, and I'll do a video about the last little bit, about how it's important, about the value of the vaccines, and how quickly the vaccines. So I'll just quickly talk about that. I've got these amazing vaccines coming along in trials, and yes, it'll just be too long if I could keep on about that. You can see where this is going for the rest of the video. So I'll talk about that separately. So as you can see, I'm very positive what we can do in the future. That's about how we've managed to improve on how quickly we can vaccinate. I know, I'll just go through the titles of this and do a short video that way, and then I'll do the and then I'll do these other videos.